discuss BPC 145, Block 4, Areas of Application of Counseling. So, in this, we are going to discuss Unit 10, Child and Adolescent Counseling. So, what we are going to learn today? So, we'll see the what is adolescence and developmental changes during adolescence, behavioral and emotional disorders. We'll discuss in detail about the developmental disorders, substance use, impacts of substance use on adolescents, counseling in substance use disorder, prevention and treatment, and commonly used approaches to treat substance use disorders. So basically, learning objectives are to understand various types of disorders in children and adolescents, to explain counseling techniques used in child and adolescent counseling, to understand the concept of substance use and counseling technique used in it. Let us see what is adolescence. So childhood and adolescence, the most crucial and sensitive stage. We all know that, and they are basically preparatory stages for the adulthood, involving many types of developmental changes: physical, psychological, emotional, social. And adolescent is a basically bridge between childhood and adolescent, and the same way, like the childhood is the stage between infancy and adolescence. So it is marked by swift changes in physical, cognitive, and emotional aspects. So we all know that during the adolescent stage, there are so many changes seen in the child, adolescent, and it's very important for the parents and teachers to understand those changes. So let us see these changes one by one. So first we are going to see physical changes. So we all know that the adolescent's body is at a growing stage. The height is increasing, the body mass is increasing, and secondary sexual characteristics like changes in voice, speech, mustache or beard in uh, male, and then development of the breast in female. So there are so many physical changes. Are so this is the duty of the parents to discuss about these changes with the adolescents so they can become comfortable with these changes. Sometimes the adolescents they do not feel comfortable with such changes. There are lots of cognitive changes occurs during the adolescent stage. It's related to reasoning, like reasoning develops a lot. Abstraction ability. Abstraction means like seeing the things and thinking about at the abstract level. For there are three stages of this abstraction. The lowest level is called uh, concrete level of thinking, then functional level of thinking, then abstract level of thinking. So, for example, if you ask the adolescent what is the similarity between table and chair, so if the adolescent say both are made of wood or both are having four legs, so this shows the concrete level of thinking. If the adolescent says they are used for study purpose or for writing purpose or for some other purpose, so it is considered as functional. If the adolescent say both are furniture, so it shows abstract level of thinking. So this thinking basically abstraction ability develops. Then visual spatial orientation also, like earlier when the adolescent was child, he used to forget the way. So now the child remember all the ways and the bus routes, metro routes, and all these things. So and we'll discuss in later how this is related to independence of the child. Then problem solving ability. So the child works on the problem solving abilities and it improves a lot during this adolescent stage. There are significant emotional changes seen in adolescents, like exhibiting more anger, hostility, fear, anxiety, and lacking an emotional competence. So, because at this stage, the child adolescent is at a growing stage, so may not have total emotional control. So that's why the some of the child becomes very sensitive, touchy, and they cry on a if they are scolded. So these changes are seen in the adolescent, and parents should know that. Counselors should also know that these are the part of the developmental phase of the adolescents, and if they are more, then how they can manage. So the best way is to discuss about these changes with the adolescent. However, with the increased age, a balance is achieved. So most of the adolescents, they actually develop some amount of control over their emotional competence. So there are psychosocial changes also seen, like changes with regard to independence. Basically, all children, they thrive for independence. If parents say that "Ki, you can't go alone, someone will accompany with," the child objects, "No, I can go alone." Then the child focus on the social relationship, the adolescents, and adolescents generally they try to make friends, other relationships, sometimes romantic relationship also, and they strive for autonomy. So they like they do not want to become dependent on their parents. So though they are dependent financially and otherwise also, but they basically try to show that they are now independent. They can take their own decision. They can decide about their life. They can decide. They can choose whatever they want to do. Then, at this, psychological changes are also seen in identity formation. So, the child basically, the adolescent basically try to show his identity differently from the others. And sometimes adolescents they try to copy the others' identity, and they try to show that they are different. So sometimes they copy filmy actors or actress. They try to make haircut like this. They show behavior like that, and future orientations. So basically, they are a little bit concerned about their future and career also. Let us see what are the behavioral and emotional disorders seen in adolescent stage. And let me tell you, almost all psychological disorders, behavioral disorders, emotional disorders, they start during the adolescent stage. The, the some symptoms generally it starts during the adolescent stage. So let us see what are these different disorders. So one of the most commonly seen disorder is attention deficit hyperactivity disorder called ADHD. So in this disorder, the child is basically suffering from inattention. It's very difficult for the child to attend a task for long period of time or for required period of time. Impulsivity, there is a difficulty to control the behavior. So if the child wants something, he has to get something. Hyperactivity, it's very difficult for the adolescent to sit at a place, so he always run around. And so teachers basically find it very difficult in the class because they disturbed a lot. Why? Because they can't sit at the same place, and they have difficulty in concentrating. So that's why they commit lots of mistakes in writing or reading. But this is not to be confused with overactive children. Some of the children are overactive, not hyperactive. Another disorder is called eating disorders, where the problem is seen in eating habits. So there are two types of eating disorders: anorexia nervosa and bulimia nervosa. So anorexia nervosa is an irrational fear of gaining weight, so they starve themselves to remain thin. So this is seen in female. Now it is seen in male also. So generally they do not eat enough. Why? Because they have the fear that they may gain weight. So they, and even though they are underweight, they they want to remain more underweight. Another illness is bulimia nervosa, where the binge eating. Binge eating means you eat, when you eat a lot, binge eating, and then purging out the eaten food because of guilt feeling. So when you eat a lot, then you develop guilt feeling. Why I have eaten so much? Because I am already overweight. So you try to vomit. Let us see that another very commonly seen disorder called conduct disorder. So basically, conduct disorder is a repetitive and persistent cruelty towards people or animal. So they basically do show that cruelty. They do not show any empathy or kindness to other insects, animals. So they hit an cat, dog, or insects. Okay. So then dishonesty. They are not honest. They tell a lie. They try to take the money from the home without telling anyone. And even though they tell a lie with their parents, teachers, friends, okay, and they are aggressive, they are destructive, and they have lack of remorse and carelessness. Even though they have committed some crime, something wrong, they do not feel that they have done something wrong. So this is called a lack of remorse. Obsessive compulsive disorder, in short we call OCD. So basically this is the disorder of where all the time patient is getting repetitive thoughts, and he has to do certain actions. So what is obsession? Obsessions are repetitive intrusive thoughts which come against the will of the person and creates lots of tension and anxiety. And compulsive behaviors are such behavior which are done repeatedly to reduce the tension or anxiety. So the most commonly obsession compulsions are seen, like obsession of contamination, that is dirt or germs, and compulsive washing of hands. So the obsession of contamination and washing rituals are very commonly seen in OCD. There are other obsessive compulsive symptoms, for example, checking, counting, arranging things in a particular order. Okay, but see, the quality, you have to remember, not all such behaviors or thoughts become obsession or compulsion. So you have to remember that the quality of a obsession is they come against their will and they cause lots of tension. So this is, if they do not come against their will, it means they may not be obsession. For example, in a religious thought, people want such thoughts. Religious rituals, if person is doing something, it is not considered as compulsion because it doesn't cause tension or anxiety. So another disorder is seen in adolescent stage is separation anxiety disorder, development of extreme fear and nervousness or anxiety due to the perceived separation from parents. So and due to this, the adolescent may develop anxiety. Specific phobia, like phobia related to particular situation or object or a person, like intense irrational fears of some objects, places, activities, and or situations, etc., that are persistent and obtrusive in nature. For example, school phobia, where the adolescent or child want to avoid the school, or lizard phobia or dog phobia. These are called specific phobia. Some of the people are having height phobia or lift phobia. They avoid the lift. Social phobia. So, an adolescent avoids social situations as they cause intense anxiety. For example, fear of speaking and interacting within the class, as others may make fun of him or her. So, generally, they avoid social situations where lots of people are there. In classroom, they want to avoid speaking. On a stage, they can't perform, or if they perform, they feel very much anxious, anxiety. It doesn't mean they do not know how to speak, but they have the phobia. Depression is also very commonly seen in adolescents, but the symptoms, remember this, the symptoms seen in adult and the symptoms seen in adolescents are totally different. In adolescents, it will be visible with the face, but in children it may not be visible just by seeing the face of the adolescent. So what is depression? Depression is a mood disorder characterized by persistent low mood or sadness, lower level of energy, like easy fatigability, we call it, and loss of interest in pleasurable activities. For example, earlier the child or adolescent was enjoying watching uh, for example, Shinchan or Nobita or any other Doraemon. Okay, so now he is still watching. The child is still watch the serial, but he or she doesn't enjoy. Like earlier, they were enjoying. Now, no enjoyment. So there are some developmental disorders also seen in adolescent stage, and generally they occur at the beginning of childhood. These are related to delayed or retarded physical, cognitive, social, or emotional development of the child. Till now, we have studied about the deviation in the behavior or thinking. Here, it is related to the retarded or delayed development. So, they may hamper activities of daily living and normal functioning of the child. For example, intellectual disability, earlier it was called mental retardation, learning disorders, cerebral palsy, and Down syndrome, etc. Now we'll see in brief about these disorders. So, what is cerebral palsy? A non-progressive disorder marked mainly by developmental delays and motor dysfunctions. There are exaggerated or poor reflexes, rigidity in limbs, and inability to maintain posture and coordination. So, basically, due to brain damage uh, or certain dysfunction in the brain, this cerebral palsy may occur. So, like rigidity in limbs, like you cannot move the hand, you cannot stretch the hand of the child and make it straight. It will be very difficult. So, so basically, in this disorder, difficulty in carrying out effective social communication, stereotype or repetitive behaviors, and lack of emotions. Developmental disorders, again, like Down syndrome is again one chromosomal disorders. So it occurs due to trisomy 21st chromosome, and symptoms generally seen in like Mongolian face, rough or thick skin, mild to moderate intellectual disability in seen in. They are very fond of music and dance. So whenever you call, ask them if there are any guests, or you say that just dance, so they start dancing. So they love dancing. They are very cooperative. They are very cooperative and mixing with others. They do not find any difficulty in mixing. Intellectual disability, as I told you earlier, it was called mental retardation. So, on any standardized test, if you assess their intelligence, the IQ will come less than 70. So, and there is a delayed developmental milestone, inability to learn, education beyond class 8th or 7th, and dependence on others for daily chores. So, in intellectual disability, the IQ will be less and there will be developmental delay, and this developmental delay occurs during the developmental stage, that is before the age of 18. So this intellectual disability can be categorized into four categories. Mild IQ, that is the IQ score will be 50 to 69. Moderate IQ score will be 35 to 49. Severe ID, that is IQ 20 to 34. And IQ less than 20 is profound intellectual disability. So those who are having mild IQ or mild intellectual disability, they can be little bit trained in self-care. They can do some productive work also. They can be trained in doing repetitive work in a factory or earning for livelihood. Whereas moderate mental retardation, like there is a difficulty in finding ways, so visual spatial learning is very poor. So there is a like fear that they may not come back to their home because they may not find the way and other things. So here the supervision is more required more, and like they can be trained in taking care of self only. It's very difficult to teach them in any productive, but they are engaged in certain simple tasks. Yeah. Then severe, they require more supervision, and profound generally they are bedridden and they cannot walk and do anything. Another disability which we see is called learning disability. It is very prevalent and it is seen in many adolescents. And there are mainly three types of learning disability. First one is called dyslexia, that is difficulty in reading, and dysgraphia, difficulty in writing, and dyscalculia, difficulty in calculation. So here in learning disability, intelligence may not be affected, but processing of the information is affected. So if you do IQ assessment, their IQ may be average, above average, or sometimes below average, but not, and they are not mentally retarded. But when you ask them to read, they may skip certain words, they may skip lines reading, and they may not notice that they have skipped. And in writing, they write with wrong spelling, they write the word in a reverse mm, direction. For example, F, they not write like this, they write F like this. And in calculation, they know the calculation. If you ask them 14 and 7, so they say 21. But when they do in writing, they will write 14. 21, so they write 14. 14 plus 7, if you write, they will write, instead of 21, they may write 12. So this type of problem is very common, but those who are having learning disability, they can get the certificate of disability and they may get extra time in the exam, or uh, any any person who can write for them, or they may get calculator. So the facilities are very like different in different states. Now let us see the substance use among adolescents. So first, see what is substance use. That is okay, like occasional or recreational use of the substance which may not be associated to any immediate medical or psychological disorders. So, like sometimes The adolescent may smoke, sometimes may take beer, sometimes may use gutka. So if they are using, sometimes it doesn't mean that they are dependent on the substance, but even they are using occasionally. They are called psychoactive substance. Tobacco, alcohol, cannabis, weed, called in a local term, opioids, inhalant. So all these substances are called psychoactive substance, and these substances affect their brain functioning, at least neurotransmitters. So they may, like, their brain is at growing stage, so they damage the brain also. So occasional use is also harmful for the adolescent and young adult. So, like, mm, so it is seen that if the substance is used in more amount or in more frequency, it may lead to intoxication, or it may increase the concentration in blood of the user. So substance dependence is a disorder. An intense, so what are the characteristics of disorder? An intense craving for the substance in its absence. Like when there is a no substance, so the person wants to get it at any cost. It is marked by tolerance, withdrawal, compulsiveness of substance intoxication, and affected activities of daily life. So see, what is tolerance? Tolerance is like the you will not get the same effect with the same amount. So the person started taking alcohol, so one peg of alcohol, but after some times, like after 3 months or 6 months, the one peg of alcohol is not giving the same pleasurable effect. So he has to increase the peg. He will take 1.5 peg or 2 pegs. Then if the person will get same effect. So this is called tolerance. Withdrawal means when the, like, every evening the person is taking substance, and like last evening he took, but this evening he is not taken, so he may feel restlessness, he may feel tremors in hands, shivering in body, vomiting, and there, like, depending upon the substance, there are various types of withdrawal symptoms. Intoxication means when the person is not in his original mood. So the person is totally out of the real world. Risky behaviors associated with substance use, like rash driving, getting indulged into brawls, theft, having unprotected sex, etc. So let us see the reasons for initiating substance use. Biopsychosocial model of substance use, basically it explains the biology, like genetic predispositions, if there is a family history of substance use. Psychosocial models are like experimental tendencies in the child, peer pressure, and some personality traits of the child. There are ICD-10 criteria for diagnosing substance use disorders. It is available in your course material also. I'm not going into detail, but basically there must be a strong desire, difficulty in controlling substance taking behavior, physiological withdrawal states when substance cannot be taken, evidence of tolerance, progressive neglect of alternative pleasures or interest. For example, the child may have poor marks in study due to less interest in study. Then but persisting with substance use despite clear evidence of overly harmful consequences. And the impact of substance use on adolescents, it affect on cognitive functions, leading to poor scholastic performance, effect on physical growth, and its associated negative impact on physical as well as psychological aspects of development. Interference with neurotransmitter, because all substances, they give pleasure. So there is a dopamine receptor neurotransmitter which get affected and damaged to vital organs like lungs, liver, kidney, and there are other infertility and other things. Breathing problems, uh, negative consequences on digestive and reproductive systems, and social risk like unplanned pregnancies, sexually transmitted disease, crime, economic dysfunction, and damage to close relations, etc. The impact of substance use is linked to the age of initiation, frequency, and overall time period of consumption from the age of onset. See, remember this, lower the age of initiation of substance, like if you started taking substance before the age of 25, 20, 18, 15, so higher the insult to the brain. So brain damage will be more, and there is a high possibility that you will definitely develop substance use disorder. You will become addict. So it has been very much seen in the research. Stage of early the age of initiation or starting the substance, the problems will be more. Chronic use is positively correlated with the presence of psychological comorbidities in substance users, for example, depression, anxiety, psychotic symptoms. For example, those who are taking cannabis, they think it is safe. Yeah, it won't cause much withdrawal symptoms, but it has been seen those who are taking cannabis, ganja, marijuana, weed, they most of them, around 50%, develop hallucinations, psychotic symptoms. So it will be very difficult for them, for the students, to continue their study. They have to quit the study. So commonly used counseling techniques in children and adolescents. So now, after understanding the various substances, we are going to see what can be done to help this population, to help the children and adolescents. So there are different counseling techniques available: family counseling, applied behavioral analysis, play therapy, creative art therapy, mindfulness practices. So basically, family counseling targets the dysfunctional role in the family members. Generally, it has been seen that the marital discord or absent of father or mother in the family, physical or psychological absence, will also affect in the same manner. Both child and family members must be included in family counseling. Children may adopt certain maladaptive behavior due to underlying problem in the family system. So the counselor's job is to understand the family dynamics. Problems are solved by developing an insight among all the members, and this family counseling is very helpful in managing behavioral problems like conduct disorders, OCD, substance use disorder in family. Another technique called applied behavioral analysis. So useful in managing emotional aspects, activities of daily living, behavioral outcomes in certain social settings like classrooms. For example, if the child is having scholastic difficulties, so this can be used there. These techniques can be used, what techniques I'm going to discuss, can be used in almost all types of disorders which we have studied, not only substance use. For techniques specific to substance use will be discussed in the later part of today's discussion. So this applied behavior analysis called ABA may include communication skills, self-help skills, adaptive learning skills, hygiene training, and dining manners, time management, money management, etc. Useful in management of intellectual disabilities and autism. Play therapy. Like in earlier classes also, we have discussed about the play therapy, art therapy, drama therapy. So basically, play is used as a way of communication. The children are not able to express their needs. because they do not have such vocabulary. So they play therapy is the best way to understand the children and adolescents. Play act as a medium of communication between child and the counselor. It helps in managing anxiety, autism, trauma, depression, etc. So in play therapy, you can include music therapy, art therapy, drama therapy, dance therapy. All these things can be used. Helps in catharsis like expressing their repressed feeling, anxiety, and fear, and it enhances interpersonal relationship and problem solving skills. Creative art therapy helpful in developmental disorders like Down syndrome, Asperger syndrome, autism spectrum syndrome, intellectual disability, and several other behavioral disorders, OCD, emotional disorders, depression, etc. Creative activities are there like music, dance, coloring, painting, pottering, etc. They activate their senses like touch, sight, etc. and improve pro-social behavior. Also helps in improving their cognitive abilities. Mindfulness practices basically an ability to being aware of their senses, feelings, and their presence in a certain situation. So this therapy can be used the children who are having adequate intellectual level, helps to understand emotions and senses to resolving issues related to psychophysical aspects like body image, especially in adolescents, in depression also, anxiety also. Also helps in managing depression, anxiety. Now coming to the counseling and substance use. One model was given by Prochaska and Clemente. It is called trans-theoretical model. This model has talked about 5 stages. This model says that the motivation is a dynamic phenomena. It cannot be constant. It always changes. So the counselor should know about the motivation to quit the substance among the client. So these 5 stages are pre-contemplation means the person who is an addict denies that he is taking a substance. Contemplation, the person thinks that there are some harms and he should quit or reduce. Then preparation or determination stage where the person with substance use disorder thinks he should take treatment and it try to find out where the treatments are available or try to cut down the use. Then in stage, the patient is in treatment and not taking substance. Maintenance or relapse, the client is away from the substance and he maintains abstinent, but sometimes they get relapsed, or if they don't get relapse, that treatment then can be terminated. So let us see these stages in little bit detail. So adolescents are usually unaware of the potential harms, risks, or problems of the substance use. They are concerned about quitting it. They are not concerned about quitting it. Receptive to the information about harms of the substance. So the counselor's job is to help either in reduction of the intensity or frequency of the substance. For example, I use weed hardly once in a week. So yeah, I take hardly once in a week, so it won't harm. Or in it just a weed, and it is legalized in Canada and US. So what harm it can cause to me? It's not tobacco. It may not cause cancer. In contemplation stage, the client starts noticing problems associated with their substance use pattern and starts thinking about quitting, but not immediately. Say, okay, I will take next year, I'll try to quit. weighing the pros and cons of the substance use. In preparation stage, the client is planning to quit, uh, and the counselor helps the client in formulating realistic and practical goals for quitting the substance use. In action stage, actions taken in order to quit the substance, the counselor plays the role of mediator and helps in mediating the process of quitting and providing motivation. In maintenance stage, counselor helps the client to maintain the targeted behavior like not taking substance. If the client remains abstinent, then the therapy or counseling is terminated. However, maintaining sobriety is not as easy as it seems, and frequent relapses may be seen and are common part of the treatment. So basically, if you see the substance use disorder, it is chronic relapsing illness. It means if you want to quit, you can quit for some time, but again there is a possibility of relapse. So after having few relapse, you can able to understand if you are in the treatment, and then you will be able to quit. Now see what are the prevention and treatment of substance use, how we can prevent, and what are the treatments available. So some preventive strategies like providing education about healthy lifestyle, managing peer pressure, learning to say no, and the harms associated with substance use, psychoeducation about the substance use for school-going children, TV shows for sensitizing and imparting knowledge in mass public about various biopsychosocial issues due to substance use. These can be applied on the family, schools, and community level with the help of various government as well as non-government organizations. So first of all, like parents should remain abstinent. Parents should not use such psychoactive substance, because if parents or any other family members are using such substances, it becomes model for the child or adolescent. So it will be it's likely that the child may use the substance. So the first thing is there should not be use of any type of psychoactive substance in the family. Second thing, the child should be aware about that. In the family, there should be much some discussion about the harms caused by the substance, or the basically it affects the study. And in school also, there might be some program. In community also, some awareness program may be organized. So it has been also seen that if the availability of substances are easy. For example, in every nukkar, every chowk, you will find a tobacco shop, you will find alcohol shop in the even in the residential campuses. So there is a high possibility that children of those areas may use substance more than children of other areas where the substance is not easily available. However, those who are addict, those who are already dependent on the substances, it doesn't make much difference the substance is available or not, because they know how to procure the substance. For example, in some states, the alcohol is banned. For example, in Bihar, but still you may see in the report that okay, this one truck of alcohol was caught by excise people, or people died with substance use. But definitely, if substance is not available, so it will new users may not get easily such substances. So the first step is to screen out the substance use with robust assessment tools. So in school also such programs should be done. Assist is one of the tool which can screen out about the other substances. Then developing treatment plan, execution of the developed treatment plan, analysis of the efficacy of the treatment delivered, and making certain changes to better fit the modalities of treatment. The Substance Abuse and Mental Health Services Administration (SAMHSA) uh, launched a comprehensive program including screening, assessment, brief intervention, and referral to treatment, which has been served as a stepping stone in the treatment of substance use disorder in clinical setting. So there are several international organizations like NIDA, SAMHSA, they are working on this. Now let us see commonly used approaches of treating substance use disorders. So today we are going to discuss about psychoeducation, motivational interviewing, relapse prevention therapy, family counseling, behavioral therapies, lifestyle modification. What is psychoeducation? So psychoeducation is basically an evidence-based psychotherapeutic intervention. It includes educating the client and his family or her family members, client and family, or associated people about psychological disorders. And don't forget that addiction is also a psychological disorders. uh, may be used as a preventive measures for preventing the substance use, as well as those who are already in substance taking substance. Psychoeducation can also be given to them and their family members. It is very helpful in managing emotional states and learn healthy coping skills to change the maladaptive behaviors and attitude towards the condition. So sometimes what happens, if someone is taking substance in the family, family members think that the person doesn't want to quit, but the scene is different. So with psychoeducation, they understand that even though the person wants to quit, the withdrawal symptoms will not allow the person to quit. So until unless the person is in treatment, it will be very difficult to quit. Psychoeducation can be imparted in various settings like individual settings, family setting, group setting, community setting. So in any setting, psychoeducation can be given. Let us see that what is MI. So this model was given by the Rolnick and Miller. This is a client-centered technique. It enhances the motivation of the client. So basically, this technique is used to for such clients who do not want to seek treatment. So to motivate them to seek treatment, to motivate them to remain in the treatment, MI is very important. A non-directive psychotherapeutic approach, and it is the counselor helps the client to resolve ambivalence to choose better path. So sometimes clients think, I'm taking just 1/4 bottle of the alcohol, so it is safe. How can it harm? So basically, counselor help the client or to seek treatment or not. So whatever ambivalence is there, I can take treatment after a few months. So all these things can be managed by motivational interviewing used by counselors. Certain skills required for MI: asking open-ended questions, reflective listening, providing affirmative responses. So you are not arguing with the client. The counselor's job is not arguing, not proving his point that I am right. No, so motivational interviewing is efficient in alcohol use disorder or problematic alcohol use and cessation of other substances like tobacco or cannabis. Basically, it has been seen that it is used in almost all substance use disorders, and it has been found very effective. So five key components used in motivational interview: express empathy, like you should be empathetic to the client. Decisional balancing, where you ask the client to weigh the benefits of taking the substance and cost you are paying for taking the substance. uh, then develop discrepancy, like when you were not taking substance, how are you, and after taking the substance of so many months or years, what happens. So can you achieve your goal which you were thinking earlier. Then rolling with the resistance. Resistance is very common. So this is the job of the counselor to roll with the resistance and always support the self-efficacy of the client due to repetitive relapses, the client thinks it is not possible to quit. So, counselor's job is to support the self-efficacy. So suppose that when the client is motivated and not taking substance, remain abstinence, so there is a possibility that client may relapse after some time. You might have heard that the client got treatment in some center and after discharge immediately started or after some time started taking again the substance. So because relapse is very common, so relapse prevention therapy must be used. So relapse occurs when, after remaining abstinent, drug-free, the client takes substance, taking alcohol in a party, and then again remains abstinent. So relapse occurs when a client falls back to a previous way or pattern of substance use after the abstinence. So there is a difference between lapse and relapse. Lapse means taking just once, and relapse means taking the substance in the earlier pattern. Lapse may induce guilt and feeling of failure, which may lead to relapse. However, relapse is a part of treatment and illness and often occurs due to chronic nature of substance use disorders. So, relapse prevention therapy is an evidence-based tertiary intervention. It is intended to reduce the relapse rates after the cessation or reduction of the problematic substance use. Lapses and relapses occur commonly due to unhealthy coping styles and inability to say no. Another therapy is family counseling. So commonly applied in adolescents with behavioral or substance use problems. Main notion is family issue serves as the root cause of the problems in adolescents, for example, poor parenting, communication gaps, etc. in the family. And family counseling intends to incorporate changes in behavioral and emotional problems of children and adolescents, better improvement at the academic front, and better functioning of the family. Let us see the 5 phases of family counseling. First one is engagement. The therapist builds a working alliance and tries to connect with family members. And unconditional support is also provided. Family assessment must be there. Creation of motivation to change. So the counselor talks like the way the family develops some motivation to get treatment. For example, quitting alcohol is not easy, and most people during this journey fall back to their prior habits. But the counselor says, I appreciate that you have decided to seek help for quitting it. This shows that you are really determined to quit it. So like this is the way to work on the motivation. And then conductance of primary intervention, like counseling techniques are used to intervene and break the negative cycles of problematic behaviors. For example, multidimensional family therapy. MTFT is very commonly used in family therapy with adolescents, and it is very effective in substance use disorder. Then the fifth stage is termination. So family therapy, which includes briefing about the whole process, family can contact the counselor for holding further session as per their need. Let us see the MDFT in a little bit detail. A family-centered multidimensional approach is used here. It considers substance use disorder as a deviation from the healthy and adaptive functioning of an individual due to an impairment in the familial functioning. The likelihood of deviation from the normal path or substance use depends on 4 dimensions. First, substance user, child or adolescent. Second, parents. Third, familial interaction or communication pattern in the family. And extra-familial relationship with the neighbors, with the relatives and systems. So anticipated outcomes of MDFT are increased family stability, mitigation of substance use or abuse, increased school performance or better scholastic achievements, and reduced psychological symptoms. Behavior therapies. So it is based on learning theories. We all know that desirable behaviors are reinforced and undesirable behaviors are targeted for their eliminations. So commonly used behavior therapies are cue exposure therapies, aversion therapies, and contingency management. Contingency management was seen as most effective treatment in behavior therapies. Let us see what is cue exposure therapy. So exposure to external stimuli related to substance use such as cigarette packet, empty bottle, advertisement, banner, wine shop, etc. So the counselor exposed the client to these uh, cues. The goal is to weaken the link between conditioned stimulus and conditioned response, like seeing the cigarette packet may increase the craving. So the goal is to disconnect between this. So clients are taught some healthy coping skills which are required for controlling their substance use. Another behavior therapy is aversion therapy, which is generally not in used, but like one of the medicine is given as like diazepam is administered if the client takes alcohol. After taking diazepam, there will be severe reactions like headache, nausea, vomiting, and anxiety, and then sometimes it may be fatal also. The client may die also. So, but otherwise, like earlier, the electric shock therapy or chemical aversive therapy and some other therapies were given, aversive therapies. Now these therapies are not in use due to human rights issues. But this diazepam under supervision of the medical doctors can be still in use. And let me tell you some of the like you might be seeing advertisement in the TV that you just give this medicine to the patient will quit the alcohol, but this may be lethal, patient may die also. So contingency management derived from the principles of operant conditioning. Substance use is considered as an operant behavior which is reinforced by some reinforcers like effect of substance, social or cultural approval. The goal is to weaken the effect of such reinforcement. So positive reinforcement involves using of desired consequences, providing better services, monetary rewards contingent upon the anticipated or desired behavior, increased attendance in the school, for example, or pro-social behavior or reduction in substance use. Negative reinforcement, it involves the removal of an aversive stimulus, for instance, lifting of the ban on sports or contingent upon the anticipated or desired behavior. Positive punishment, it involves using a form of punishment, grounding, suspension from the school, scolding, etc., contingent upon the undesirable behavior. For example, if the child was found substance use. Negative punishment includes removing a positive condition or circumstance, reduction in pocket money, reducing levels of warmth, love, and affection contingent upon desired behavior. Then lifestyle modification. So it is very important. So to remain abstinent for longer period of time, lifestyle modification is required. So healthy lifestyle to remain healthy is very important. Changes in daily routine, like earlier the person was not doing anything, so now the person is doing the thing. Then yoga, meditation, outdoor or indoor sports activities, doing exercise, participating in group activities, social functions where the substances are not used, keeps the mind and body healthy. For example, eating healthy things, close connection between psychosocial functioning and physical exercises. It has been very well seen that if physical exercises are done, the psychosocial functioning will remain healthy. So let us sum up. So today we have discussed about the adolescents, then we have seen about the developmental changes during adolescence, physical, emotional, psychological, social, and behavioral and emotional disorders we have discussed. We have discussed developmental disorders. we have discussed about the substance use. Then we have seen the impact of substance use on adolescents. Then we have discussed about the various counseling techniques for children and adolescents suffering from behavioral and emotional disorders and developmental disorders. Then we have discussed the counseling in substance use disorders. Then we have discussed the prevention and treatment and commonly used approaches to treat the substance use disorders. Thank you.